I'm one of the people that is against administering analgesic anyhow to patients. I fight that. Sorry to deviate a bit, when I was in Babalada, I was in the surgical ward, and most of the patients we see, they are either orthopedic patients, those that have accident, or cancer patient. And then I remember this particular cancer patient. She would always come, give me injection. You finish giving her administering penta, now. Give her 1 hour, she will come. So one of the nurses there told me, when they come like this, go and carry water for injection and give them. They will feel you give them something and they will sleep. And that was the logic. This patient came, we finished administering night drug by 10 p.m. By 11, this patient came and she's in pain. I was like, really? Penta, you're in pain by 11. It's alright. When I carry sterile water, we drew it, took it to her bedside, give her an injection of it. This woman slept till morning. She didn't wake up. So sometimes it's not even the pain, it's the psychology. You feel I'm in pain. Patient comes to me with a relative, and the relative told me they just administer diclofenac now. So what is the need of me giving penta? I should do something else now. I should chat with the patient. I should administer IV fluid. I should encourage the patient and tell the patient, okay, can you calm down? We're going to give you something else, but not penta. They've given you drugs already. This talk of a team, when you talk, your patient will feel relief. Nursing is not all about only work, doing carrying out the procedure. Sometimes you need to keep the procedure aside and talk to the patient. I always tell my patients, they are my friends. I will sit with them, let's talk. By the time we are talking, sometimes you'll be talking, the patient is crying to you that she's in pain too. You are talking to her, before you know the patient will sleep off and forget that she's in pain. That's why I say psychology. Some of the pains are not really pains like that, but there's something that I don't even know, attached to it. When you talk to the patient, the pain will disappear on its own without administering any drug. It will go. So you take your time. Patient relative told me that they administer Flotan before coming here. So why am I in a hurry to administer penta because I want the patient to come? I won't. That's the truth. Except if maybe it's our practice, me and the patient will know herself. She comes, I'll say, don't mind them, I'll give you your penta, you go back. So anytime she comes, even if you tell me what you are telling me, I'll say, oh, talk what you want to talk. Just like what you said, it's my office now, I'm in charge of the patient. Really? You are in charge of the patient, so you cannot listen to the patient relative. The patient relative too has right. They have right to access the care, they have right to decline the care. After all, nobody forced them to come. They chose to come. So if I'm telling you that I am in charge of you, it doesn't mean that you as a patient relative don't have a say. You also have a say. You can decide to tell me that I don't want your services, I'm going to another place. It's as simple as that. Always stay patient. If you are not satisfied with my services, you can go to another place. You must not accept my services in my place. If it is poor, you can go to a different place. If it is okay and you feel it's not me you want a different nurse, there's no problem. It's your choice. That's why I said earlier, patients in this part of the world don't know their rights. Patients has the right to choose whoever he wants her to treat. Patients has the right to say, I don't want this doctor to see me. I don't want this nurse to see me. It's that other one I want to see me. And it's supposed to be like that. But when they come, we're always hostile at them. Always shouting. Don't teach me my work. Don't do this. Don't do that. Are you the one that paid my school fees? Do you know how I got this certificate? It doesn't mean. It's life we're talking about here. This is not paper that you document something, after a while you can cancel it and write the correct. This is life. Like any small mistake, it can take the person's life away. And you will live with the guilt forever in your life. You keep saying, I killed this person, I killed this person, because of your negligence. So, all what I'm saying is, we should learn to listen to patient and learn to listen to the patient's relative. Sometimes, though, the patient relative want to teach you your work, but it's just for you to talk to the patient relative and tell the patient relative, no, we will not do it like this, we'll do it this way. There are times that if I want to administer anything, any drug to the patient, I first of all talk to the relative. I want to administer this. And this is why I'm administering this to this patient. So that the patient relative will know and understand what you are doing. Not that you're just doing work, you are doing without any focus, you are just doing. The patient doesn't even know what you are doing. The relative don't even know what you are doing. The relative will ask you, which drug did you give the patient? It's none of your business. Is it your work? Why are you asking? Why won't they ask? They have right to know. Because they brought in their relative there. So they have right to know. Whatever you are doing, either good or bad, they have right to know.
It affects both parties, both negatively and positively. Okay, a positive aspect is that since the patient relative told me that my sister reacts to that food because she has ulcer, what I will need to do is I will ask her, how do you know she has ulcer? It's just simple things, simple 1, 2, 3 put together. How does she react to it? There are people that when you give them diclofenac, they vomit blood. I've seen several patients. They vomit blood, or immediately you give them the accompanying of chest pain or abdominal pain. Then you should know that the patient relative is telling you the truth. So don't even think of administering the diclofenac. Rather, go for another different one that you can administer. Because at least you've learned something. That's why it's a positive. As a nurse, she has learned something that this particular patient reacts to diclofenac. I won't think of giving. I will document it. Patient relative says patient reacts to diclofenac. So that when I'm handing over, I'm not around, the next nurse that will take over and will see it and not to think of administering it, because this is what the patient relative said. And then if I go ahead and give, the patient will suffer it. And that's the negative aspect towards the patient side. Why should I complicate issue instead of trying to assist or instead of trying to help the patient to recover? I'm supposed to listen to whatever the patient will tell me. That's why I said earlier that I always tell my friends when we're in school, I'll tell them, if patient say I want to see you, even if it is for 5 hours, sit with that patient and hear what the patient will see. The patient will teach you a lot of things. But the fact that I went to school and studied nursing, it doesn't mean I know everything. There are some experiences that we learn from the patient. Like the patient that will tell you, I don't take this because if I take it, I react to it. Don't give. Once you tell me you react to this, I don't even need to force myself to give you or argue with you. It's very simple. I won't give. Because if I give, I'm putting myself in trouble. Because if anything happens to that patient, they will hold me responsible. Because already the relative said that the patient reacted to this. So I'm not supposed to give. Most of the times, when the patient relative said the patient reacted to this drug, you start shouting, are you teaching me my work? Do you know how long I've been doing this nursing work? For the past 20 years, I've been doing this nursing work. You just come today and start telling me, commanding me up and down. Yes, it's the patient's body. The patient has right to do whatever. That's why we have patient's rights. And it's because patients don't know their right, that's why they take anything from the nurse. I always tell people, I say it's in this part of the world that patients don't know their rights. The nurse will tell you rubbish, you sit down and look at her. The nurse will look at you, will do anyhow until you look at her. I'm not saying that a patient has the right to tell to look down on the nurse or insult the nurse because the patient has right. No. We should work as a team. Without the patient If I come to work, what will I do? I'll just sit down like this and be looking at you. I'm in watching time. Once it's 2 p.m., I'll take my bag and go home. Or if there is patient, I'll work. That's why I'm there. I'm there for the patient. So we have to work together in synergy. You are my patient, I'm your nurse. If I have any issue, patient, this, the patient will tell me. If the patient has any issue, call me, nurse, I will come. What is it? This. Please give me this, give me that. If I won't give the patient this, I will tell you, sorry, I can't give you this. This is the reason why I won't give you. Not that, no, it's not like that. We're not supposed to do what stuff like that. No. In everything you are doing to the patient, you're supposed to explain. Everything a nurse is doing to a patient, the patient is supposed to ask the nurse, why are you doing this to me? Why are you giving me this particular drug? The nurse supposed to know the reason why she's administering this drug for you. Why are you giving me penta? I will tell the patient I'm giving you penta because of your pains. I want to relieve the pains. But if you opt out, you said you don't want it, fine, I won't give you.